So a warm welcome to you all in this new video where we will be starting about hypertension pharmacology. Now, what is hypertension? So hypertension, we will write a definition first. So hypertension, it is a cardiovascular disease which is characterized by systolic BP blood pressure more than 139 and diastolic BP more than 85. Okay, and the complications are it affects the heart, the brain, the kidneys and the eyes. We have two types of hypertension. We'll just write the names and I will just dictate what is it. Primary and secondary. Primary, as it has no specific cause, and secondary is due to some underlying renal or vascular causes or endocrine or any other disease. Okay, now while studying about hypertension pharmacology or in general hypertension, we should know the basic physiology of the renin angiotensin aldosterone mechanism or the RAS mechanism. So what happens is, what is this RAS system? The name itself says renin angiotensin aldosterone system. Okay, now what happens is, if there is decreased BP, the sudden decrease in the body, okay, sudden decreased blood pressure in the body, so what happens is it triggers the brain. Okay, now the brain will go to the kidney, like the signals will go to the kidney and it will stimulate here the beta 1 receptors on the juxtaglomerular cells. Now once the beta 1 receptors on juxtaglomerular cells or GG apparatus get stimulated, they will release one compound, okay, that is renin. Okay, and side by side the liver, this is the liver. So the liver, what basically the liver does, it synthesizes a thing called angiotensinogen. Okay, just let me, yeah, it will secrete this angiotensinogen, and this renin, what it will do, it will carry a reaction. It will convert this angiotensinogen to angiotensin 1. Okay, now we have another enzyme on the surface of the lung. Okay, on the surface of the lung parenchyma, the surface of the lung parenchyma, we have this enzyme named as ACE enzyme. Okay, I will write the short form. ACE here to angiotensinogen. Okay, this ACE enzyme is present on the surface, and what will it do? It will carry a reaction to convert this angiotensin 1 to angiotensin 2. Just a second. Okay, and now this angiotensin 2, let me just highlight this. Okay, this angiotensin 2, it is a powerful vasoconstrictor. Therefore, it will go and it will decrease the lumen of the blood vessel. Okay, so let's revise what is RAS system. So what happens is, when there is sudden decrease in the BP, it activates the brain. Now the brain will stimulate the beta 1 receptor on the kidney, specifically the juxtaglomerular cells. Now this renin, what it will do, this renin will convert this angiotensinogen, which is obtained from the liver, to angiotensin 1. Now this angiotensin 2 via this blood vessel, it will go to the lungs. From the lung parenchyma we have this ACE enzyme. This ACE enzyme will convert this angiotensin 1 to angiotensin 2, and this angiotensin 2, as we know, it is a powerful vasoconstrictor. It will constrict the blood vessel, and due to constriction the BP will increase. Okay, now this is the basic RAS system that should we know. I will come back to this RAS system, but first let me just write the classes of drug which are antihypertensives. So antihypertensives, I will first write these classes and then explain them you one by one. Okay, now first class, just a second. First class is ACE inhibitors. Second is direct renin inhibitors. The sequence should be actually reverse, so sorry. So you will know it better. What is it? Direct renin inhibitors, then ACE inhibitors, then we have angiotensin receptor blockers. Okay, then we have, these are the main classes. Okay, so let me just highlight them. And we have the calcium channel blockers. Okay, then we have sympatholytic agents. Sympatholytic agents. In this we have the beta blockers. Then we have alpha blockers. And also we have centrally acting sympatholytics. Okay, and lastly we have the vasodilators. And as you know, vasodilators have arterial dilators, they have venodilators, and they have both. Okay, now at first I mentioned that these three are the main classes: direct renin inhibitors, ACE inhibitors, and this ARB blockers. Sorry, the angiotensin receptor blocker, which are also known as ARB blockers. Okay, so why did I said that? Let's go back to this, the RAS system. So in this RAS system, you may have observed one thing. We have generation of renin. Okay, since renin is generated by this beta 1 receptor stimulation, if we bind this renin, okay, this renin is binded, so this angiotensinogen will be not converted to angiotensin 1, and further angiotensin 2 will be not converted, so the vasoconstriction will not occur. Okay, so in this way it will decrease the BP. It will not let the BP to be increased. Now the second class, ACE inhibitors. This is the main class of the three classes. Okay, so this ACE inhibitors, if this ACE enzyme, which is on the lung parenchyma, is not released in the blood, so this angiotensin 1 will be not converted to angiotensin 2, and therefore the BP will not increase, rather it will decrease. Okay, and what is this angiotensin receptor blockers? One thing I forgot to mention, at first. So what happens is, when this angiotensin 2 gets released, there are receptors on the blood vessel. Okay, these receptors are angiotensin receptors, angiotensin 2 receptors. So this angiotensin 2 receptor, what it does, angiotensin 2 receptor, when it is stimulated, that increase BP. So if we block this receptor, okay, if we block this receptor, there will be no stimulation of this receptor due to angiotensin 2, and thus the BP will not increase. So this work is done by this angiotensin receptor blocker. And as you know, this calcium channel blocker, what does calcium channel blocker do? Basically, this calcium channel blocker will do vasodilation. What about this beta blocker, alpha blocker, and centrally acting sympathiolytics? They will do vasodilation. Okay, and vasodilator, the name itself says vasodilation. So these are the 6 classes which will prevent the increment in BP, rather it will decrease BP, and therefore they are included in this antihypertensives. One more class I would like to add is diuretics. So what do diuretics do? Diuretics basically, they decrease the fluid in the body, thus causing decrease in the BP. Diuretics. Okay, now we will diuretics. Now we'll see the individual classes of drugs. Okay, starting with direct renin inhibitors. So direct renin inhibitors. So we know the mechanism of action. Mechanism of action is, it directly binds to renin, and thus the process of increase in the BP does not occur. Now mechanism of action is done, then the mechanism of administration. So it is administered orally. And what is the name? So these drugs will end with iron. Okay, the name of the drugs, we have only one drug which is known as aliskiren. Okay, we have one drug, aliskiren, Then we have the side effects. Side effects are common side effects which include diarrhea, nausea, vomiting, and angioedema. Okay, and one special point, they are generally given with diuretics to increase its action. Okay, and contraindications, pregnancy. Very basic drug. Okay, so this was all about direct renin inhibitors. The mechanism of action, it directly binds to renin. Then mechanism of the administration is orally. These drugs ends with the suffix iron. Then the drugs, the name of the drugs, aliskiren. Then side effects is diarrhea, nausea, vomiting, angioedema. And the special thing about it is generally given with diuretics. Contraindication is pregnancy. Now going ahead with the very important class, ACE inhibitors. This is the most important class. Okay, this is the most important class. Theoretically it is most important. Okay, now the mechanism of action. The mechanism of action is, it blocks ACE enzyme. Okay, so what happens? The angiotensin 2 will not be produced. So what it causes? Dilation of arterioles. Also, we have one mechanism where this angiotensin 2 accessorily acts and it increases the aldosterone production. Okay, so aldosterone production will be decreased. So decrease aldosterone. And we know this aldosterone, what it does, this aldosterone, it basically reabsorbs the sodium and water. Okay, sodium and water retention. So decrease Na plus and H2O retention. Okay, and also we have one more important point. So what happens is, when this angiotensin 2 is produced, okay, the bradykinin enzyme is produced in the lungs. This bradykinin is also prevented from metabolism. Okay, so decrease degradation of bradykinin. Okay, so these are the three main mechanisms which are caused by the ACE inhibitors: the dilation of the arterioles, decrease aldosterone production. So decrease aldosterone production, what will be the effect of it? The sodium and water retention will be decreased, and the decreased degradation of bradykinin. This point is very important because this will tell that we have to change the drug. One side effect, if seen due to this, will tell us that we have to change the drug. Okay, and this will lead to decrease blood pressure. Basically, these two mechanisms will lead to decrease blood pressure. The mechanism of action is done. Okay, then we have the administration. How it is administered? This is administered orally. Okay, and also intravenous administration. Now, the drugs, all the drugs in ACE inhibitors will end with pril. Okay, the name of the drugs. The name of the drugs are with a mnemonic which says CRPF BELT. Okay, so C for captopril. Captopril is not used because it is banned. Then we have ramapril. We have perindopril. This perindopril drug is the longest, so I will write L, longest. Then we have this fosinopril. This fosinopril is renal safe, so I will write RS. We have benzopril. We have enalapril. We have lisinopril. We have trandalopril. This enalapril drug is given IV, okay, in emergency, so I will write it IV. Okay, so these are the drugs in ACE inhibitors. Now the adverse effect. The adverse effect we can remember the mnemonic named as daru. Okay, so what does daru stand for? Dry cough, a very important side effect. Let me just highlight. Okay, dry cough, angioedema. So angioedema will be observed in the patient's nose area or the throat area, larynx, okay, or the lips. Most common, nose and lips. Then what is R? R is rashes, and U is urticaria. So why did I highlighted this? What is this dry cough? Why did I highlighted this? Remember earlier I said the mechanism of action also include degradation of bradykinin is reduced due to ACE inhibitors. Now, since these levels of the bradykinin are increased in the body, what does this bradykinin do? If it is increased beyond its ranges, it will cause dry cough. Okay, and when we see dry cough, it is an adverse effect, so we have to change the drug. Okay, therefore we change the drug from ACE inhibitor to our next class, which is ARB blockers or angiotensin receptor blocker. Okay, now first, contraindication. Contraindications, it is avoided in pregnancy due to high teratogenic effect. Increase teratogenic effect. One famous drug given in pregnancy, okay, famous drug treatment in pregnancy, labetalol, beta blocker, okay, labet. Now this was all about ACE inhibitors. ACE inhibitors, the mechanism of action, it blocks the ACE enzyme, angiotensin converting enzyme. So what it does, dilation of the arterioles, decrease aldosterone, so decrease H2 and Na plus retention, therefore decrease BP, and also decrease the metabolism or degradation of bradykinin. Administration, it is oral IV. Okay, drugs are CRPF belt, and then P is the longest acting perindopril, fosinopril is renal safe, and enalapril is given IV. They all are prodrugs. Let me just add a note. All are prodrugs except captopril. Okay, and what does the actual drug is? For example, this is enalapril. So the enalapril is the prodrug and enalaprilat is the drug. Okay, now going ahead with the ARB blockers. But first we will see the drug interactions. Okay, some important drug interactions. So the drug interaction, the ACE inhibitors is a minus sign for ACE inhibitors, and potassium sparing diuretics, K plus sparing diuretics. So tell me one thing, what does ACE inhibitor do? ACE inhibitor decreases the level of the aldosterone. So Na plus and H2 retention is not done, so it is lost in urine. So the potassium is increased in the body. And if we combine the potassium sparing diuretics, also potassium will be conserved. So it is dangerous in hyperkalemia. Yes. And now ACE inhibitors and NSAIDs. Okay, ACE inhibitors and NSAID, why? Because NSAIDs, they inhibit prostaglandin synthesis, okay, which promotes the Na plus and water retention. Okay, so ACE inhibitor, what it does, it decreases the Na plus and H2O retention. Also the NSAIDs will decrease. Okay, the inhibiting prostaglandins, the NSAIDs will inhibit prostaglandins, and the prostaglandins, what it does, it do promote the Na plus and water retention. So the dehydration will be increased, therefore it is avoided. Okay, then what are they safe in? One last point. So they are safe in chronic heart failure, patient with diabetics, specifically diabetic neuropathy. Okay, then hypertension, myocardial infarction. Okay, now going ahead with the drug named as ARB blocker, angiotensin receptor blocker, the ARBs. Now theoretical importance is given to the ACE inhibitors, but practical importance is to ARB blocker, because ARB blocker are the drugs which are in use. Okay, you have been hearing telmisartan everywhere, so telmisartan comes under ARB blocker. Okay, what does ARB blocker do? The mechanism of action of ARB blocker: blocking angiotensin receptor. Okay, angiotensin receptor. Okay, and to be specific, angiotensin 1 receptor. Okay, now we have seen in ACE inhibitor that the mechanism of action includes decreased degradation or metabolism of bradykinin, but in this there is no role of bradykinin metabolism. Okay, so therefore we do not see dry cough, and therefore I said before that if we see dry cough with ACE inhibitor, we change the drug to ARB blocker. And now the mechanism of administration. So these are oral drugs. Okay, now the drugs ends with sartan. Okay, now we have the names of the drugs. The names of the drug has a mnemonic: Times of India, LEV. So telmisartan, most frequently used drug, as can be used when patient associated with comorbidities. For example, if the patient has diabetes and hypertension both, we can give telmisartan. Okay, we have olmesartan, we have irbesartan, we have losartan, we have eprosartan, and lastly valsartan. Okay, now the side effects. Side effects is headache, then hypotension, rashes. Contraindications: pregnancy. Okay, and we have seen the benefit of sartan drugs or the ARB blockers over ACE inhibitors, that it doesn't cause that bradykinin kind of thing. The metabolism of bradykinin is not affected in case of ARB blockers, and therefore we do not see dry cough. So therefore these sartan drugs have become the drug of choice as first line anti-hypertensives. Okay, so that's it for this video. Rest of the classes will be continued in the next video. Thank you. We have seen the 3 classes: direct renin inhibitors, ACE inhibitors and ARB blockers, and rest of the classes will be continued later. Thank you.